Hi everyone, here again is Upstream Health with Ify. I hope you all are having a very beautiful Friday and looking forward to a very beautiful weekend with your loved ones. So today I'm gonna go ahead and answer our questions. I know most of you have been sending in your questions through my Instagram, and I did promise that I'm going to go through those questions one by one. Some of them are actually private. I don't have to come out here to answer those questions, so I do that privately. And I thank you all that have been sending those questions and keeping me busy. So now for this question, this is more like a public one that I can come up here to answer because I know it's going to benefit a lot of you. So this question says, so my doctor gave me a cholesterol medication called simvastatin, and my I checked my labs and my labs are normal. I stopped that medication. What is the implication? So this person asks a question that the doctor prescribed her cholesterol medication, simvastatin, and she's saying that her labs are normal. So this, if you, I know there's so many of you that are on cholesterol, that might be on cholesterol medication, and you're thinking, oh, your LDL, your total cholesterol, your triglyceride, your HDL, that everything is within normal levels. So it doesn't always go that way. You might have your numbers within normal level and your doctor might want to put you on the cholesterol medication. This is why. So we look at different risk factors before we put you on a cholesterol medication. Let me give you a case scenario. Let's say someone who is 55, male, obese, has diabetes, also has high blood pressure, doesn't even have high blood pressure. So let's say a male or female in the 50s or in the 40s has diabetes, and the lipid profile, that's the LDL blood work or the cholesterol blood work, is normal. And then you're wondering, why should your doctor put you on a cholesterol medication? This is it. So there's what we call ASCVD calculator. So we use that to check your risk of having a stroke or heart attack in 10 years. So when we input your numbers, so there we kind of compute your risk of having a stroke or heart attack in 10 years. If it's above 7.5%, even sometimes 5%, we will put you on a cholesterol medication. So now we're talking more about primary prevention. So not actually treating the cholesterol, high cholesterol. What we're doing is primary prevention, trying to prevent you from having a stroke or heart attack. You hear sometimes they put some patient on aspirin also for stroke prevention, not because they had stroke. Some of them don't even have stroke and we still put them on aspirin. So if your doctor tells you, hey, I need to put you on a cholesterol medication even though your lipid levels or your cholesterol levels are normal, it is a right thing to do. It's called primary prevention, to prevent stroke or heart attack in 10 years, because already you have other risk factors that makes you prone to have a heart attack or stroke, like the diabetes, like the blood pressure, or metabolic syndrome, which means you have like insulin resistance, you're obese, or you have high blood pressure, even if you're not on blood pressure medication. So there are so many risk factors. You might be obese, you might have high blood pressure, you might have diabetes, and if your cholesterol levels are normal, they still have to put you on cholesterol. So if you stopped your medication, the cholesterol medication, our advice, you go back to your doctor and speak to him. They can find other alternative for you. Maybe lifestyle modification can work, and then see if you lose weight. That's if you're on the big side. Okay, sorry about that. So you have to go back to your doctor to explain to you why he placed you on that cholesterol medications. Ask him, doctor, what other risk factors do I have? Your doctor is going to explain that to you, that there are other risk factors, which is why he or she put you on the cholesterol medication. Okay, so it's not right for you to stop your medication. And again, I want to say it here again, don't ever stop your medications without talking to your primary care provider. There are some medications that you stop, you have what is called a rebound, especially with blood pressure medications like thyroid medications. Your doctor need to wean you up, like gradually take you off those medications where they reduce the dose gradually until you completely come off those medications. Don't ever stop your blood pressure medications or your thyroid medications. Some other medications also, don't ever stop it. It can give you a rebound effect, which means you're going to have a worse symptom that you're initially treating. Okay, so I believe I did answer this question about cholesterol. Your levels don't have to be abnormal before your doctor put you on a cholesterol medication. Also talk to your doctor and find out which of those medications are better for you. And before your doctor puts you on a cholesterol medication, or before anyone puts you on a cholesterol medication, make sure your liver function test has been checked. If your liver function test is abnormal, they cannot place you right away on a cholesterol medication. They need to find out which one is better for you, because cholesterol medication also can have an effect on your liver. So your liver has to be in good working condition before your doctor or your primary care provider places you on a cholesterol medication. So I hope that was the answer you needed. Okay, so I have so many other questions, and I'm gonna go by, like I said, picking a question that is able to answer a lot of other questions, right? Provide, like, trying to kill, like when people say I want to kill two birds with a stone. So that's what I'm gonna do. So the next question I'm gonna deal with is this one on high blood pressure. So I want you to look out for that in my next video, and I have to go back to work now. I'm actually on break. Bye, and have a blessed day. Bye bye.